is a clinical stage biotechnology company that is focused on developing proprietary new therapies to enhance the function of regulatory T cells. And the company just came out with a new study. With me to explain the significance of this, Dr. Adrienne Hepner, the President and Chief Medical Officer. So great to have you here. Let's get right to the news. This is a study with the Houston Methodist Research Institute, right? So tell me what you were studying and what the results were.
First, thank you for having me here. Nice to see you again. Yes, we just released the data, presented the data of the study that was done at Houston Methodist, as you said. The study was led by Dr. Faridar and Dr. Appel, and it was conducted in patients with Alzheimer's disease. As you know, it's the most, Alzheimer's disease, yes, the most common form of dementia, I'm afraid. And those patients with dementia these days have very limited treatment options. So the study was an open label study, small, but with robust data in our opinion. 8 patients received our treatment that we call Coya 301 over the course of monthly cycles for 4 months. And then we follow those patients for additional 2 months after receiving the treatment. What we saw is, what is getting us very excited, is multiple areas where we believe we are proving our mode of action of our product. First, as you said in the introduction, we are focusing on enhancing the activity of regulatory T cells, or Tregs. We saw an increase in the function of these regulatory T cells, which are very important components of the immune system. Because when these cells do not function properly, inflammation goes up. And when inflammation goes up, this is related to the severity and the progression of many diseases, including neurodegenerative diseases like Alzheimer's dementia, ALS, or Lou Gehrig's disease, Parkinson's, etc. So this is very serious conditions of high unmet need. So we saw an increase in the Treg function. We also observe that these pro-inflammatory markers that you can just measure in the blood of a patient went down in the same way that the Treg function went up. So a nice correlation showing the decrease in the inflammation. In addition to that, most importantly, these patients did not experience a decline in their mental functions over the course of the study. You know that these patients with dementia have their mental functions, cognition we call them, as a medical term, but these mental functions are impaired, meaning they have difficulties with memory, functioning in relationships, understanding where they are, what day of the week they are, recognizing familiar things to them. That's one of the devastating aspects of these diseases. So, and we saw that these patients, using validated scales, did not decline over the course of this treatment. And then when the treatment stopped, actually we saw the opposite, meaning the Treg function went down again, as proving that what we did before was exactly what we expected to see. And then the inflammatory markers increase again. And in some instances, the patient started the cognitive decline one more time. So we are very excited about this data, obviously. And now we continue analyzing the result of the study, and we are thinking about our next steps.
Yeah, that's what I was going to ask. So what is next then? Is there a bigger study, or what typically happens?
Well, typically is that what happens. In our case, we continue, as I said, reviewing and analyzing the data, evaluating the best path forward. But we hope that in the not so distant future, we have nice announcements about our therapy for dementia.
Now, would you consider partnering with another pharmaceutical company to either, bring this to market, or maybe they have a treatment that would work really well with what you're doing?
Well, that is a great question, because patients deserve our best efforts. And joining efforts with other people, smart people, have the same motivation and the same mission is always going to be good for patients. So in short, yes, I believe that joining efforts in this particularly difficult field is something that we should consider.
I
Absolutely.
feel like it's been the holy grail for years to try to find some kind of treatment for Alzheimer's. There's just really nothing out there.
You are right.
So can you explain it further? I mean, how you're working to suppress the inflammation? I mean, just talk a little bit more about this treatment and how it works exactly.
Yes, of course. So the immune system, basically, like many other systems in the body, under normal circumstances, are what we call homeostasis, meaning in an equilibrium, they are balanced. In the case of diseases, this balance goes away. And particularly in our field, inflammation, in this case neuroinflammation, is driven by the dysfunction of the regulatory T cells, which are a very important component of the immune system. So as I was telling you, when these cells are lower in number and in function, the other side of the immune system is there to increase inflammation, the T effectors, the other group of cells that are driving this up. So our goal, is what we are doing, is to restore the function of the regulatory T cells to basically achieve one more time the balance in the immune system. By doing this, ameliorating, decreasing the level of inflammation, we believe that we have a very good therapeutic tool to basically ameliorate also the decline and the severity of these conditions.
Well, and the study of the inflammation is fairly new, right? I mean, I don't remember, I've had Alzheimer's in my family, and I don't remember that ever being discussed. But it seems like this is a new way to kind of attack Alzheimer's.
It's relatively new.
Yeah.
You're correct about that. So regulatory T cells were discovered not so long ago, were discovered by Dr. Sakaguchi in 1995. And by the way, Dr. Sakaguchi works with us. He's part of our advisory board. So we're very, very proud of having him close to us. Then Dr. Stanley Appel at Houston Methodist, the modern father, or the father of modern ALS, and in my view, also one of the key drivers in the research of neuroinflammation, found that also these Tregs are not functioning properly, not just in autoimmune diseases or other conditions, but also in these chronic diseases of the nervous system, what we call neurodegenerative conditions. So following his research and following his discoveries, as you are saying, in inflammation is where we are landing now, restoring the function of these Tregs. So neuroinflammation has been around for quite some time, but it's relatively new compared to other theories or other mechanisms that were proposed as driving these diseases.
And it seems like it's got some promise to it as well. So
we agree with that.
Yeah.
We hope so, and we continue doing our best efforts to hopefully deliver safe and effective treatments to patients.
Now you mentioned ALS. So tell us about developments with its Coya 302.
Yes,
Okay.
That's exactly right. Coya 302 is another product in our pipeline, our leading product in our pipeline, which is a combination of two biologics. With Coya 302, we just released data in late March, also in an open label study that was led by Dr. Appel at Houston Methodist in 4 patients with ALS. And we saw that over the course of treatment up to 48 weeks, so 11 months, relatively long time, especially for these patients that decline so rapidly in general. So just to give you some reference, most patients with ALS unfortunately die within 2 to 5 years after diagnosis.
Okay.
So what we saw up to 24 weeks of treatment, that these patients did not decline in their motor function. And beyond that, up to week 48, it was a minimal decline compared to the anticipated progression that you see in this patient.
See.
Yeah, exactly. Yes.
All right.
So we are also very excited about that
Yes.
data.
So, finally, what's next? What can we look forward to with Coya? Sounds like further studies on both of these treatments.
Yes, a lot of things going on at Coya these days, following these nice pieces of data. Again, as I told you, we continue analyzing the data. We are planning to file an application with the FDA before the end of this year to continue our development for Coya 3 or 2 in ALS. And also, as I told you, we continue analyzing the data for the dementia study that we just released 3 days ago to really evaluate the best next steps we can take to move this forward.
Okay, and I'm sure we'll have you back to talk about all that.
No, thank you.
Thank you, doctor.
Thank you very much.